How are caregivers coping?
So what we know from our Spotlight report is that caregivers are not coping very well. We see the rates of burnout for caregivers rising year over year. When we started doing Spotlight 6 years ago, caregivers were getting to burnout after 5 years. Now we see that caregivers are getting there after 2.
Welcome to the Aging Vibrantly Conversations to Empower Seniors podcast. I'm Raeann Ridout, the host of the show, where we amplify the voices of senior leaders and experts in the field of aging, who impart their expertise and wisdom to enhance our understanding of aging issues and ways of living a safe and fulfilling life with respect and dignity. In our previous podcast, we spoke with James Gennaro from the Canadian Centre for Caregiver Excellence about caregiving from a Canadian perspective, focusing on policy development and advocacy for the implementation of a national caregiver strategy. Now we're going to shift our conversation to learn more about what is happening provincially in Ontario to support the growing needs of over 4 million caregivers and those in the future. Given our passion to ensuring all people age vibrantly and safely, we're looking forward to our conversation on empowering older adults and people who care for them, with information on support and resources available from the Ontario Caregiver Organization. In today's episode, I'm joined with my co-host, Tom Warner, a member of our podcast advisory committee. Tom, I'm looking forward to our insightful conversations on caregiving. We are joined by our guest, Amy Coupal, who is the CEO of the Ontario Caregiver Organization, or OCO. Amy has over 20 years' experience in the nonprofit sector and is passionate about mobilizing change through knowledge exchange and collaborations that positively impact the lives of individuals and communities. The result of this work is demonstrated through the breadth of the direct-to-caregiver programs and services available through the Ontario Caregiver Organization, as well as the early successes of embedding caregiving in the culture of healthcare and the amplification of the voices of caregivers to influence decision-making at a system level. As a caregiver for most of her life, Amy helped to support her brother who had cerebral palsy. She was a caregiver to her mother throughout her cancer journey and now supports her father through older adulthood. So thank you for taking the time to join us today. We understand that the caregiving experience is very unique to every person and their journey is constantly evolving, and there's no two caregivers who have the same experiences, even if they're looking after the same family member. So Amy, we are looking forward to our conversation today to learn more about caregiving and the caregiving experience from the landscape of caring for seniors in Ontario. As we've talked about in our previous podcast, that we did have the Canadian perspective. So we're looking more to learning about the Ontario, what's happening, what your organization's doing. So maybe we can get started. So for listeners who are not familiar with your organization, can you tell us about the work and the goals of the Ontario Caregiver Organization? And I think as we move forward, we'll refer to it as OCO, if that's okay. So I'll turn it over to you to start that conversation.
Thank you. And I'm really excited to be here for this conversation and appreciate the attention that you're placing on caregivers. So at the Ontario Caregiver Organization, or OCO, we support Ontario's 4 million caregivers. So these are family members, friends, and neighbors who may be supporting someone physically or emotionally at any age or stage of life, but certainly aging is a significant part of that. And so our purpose at OCO is pretty simple. It's to improve the lives of caregivers, which means there's lots of different things that we do. So we have direct-to-caregiver programs and services where we support them in their caregiving journey. We also work in partnership with other organizations across the province around improving that experience of caregivers. And we also work with government and other system partners around supporting those policy changes and bigger initiatives that can help improve the experience and those pathways and navigation for caregivers. So lots of work to be done and more to come, because we know that there are many more caregivers. We expect the number of caregivers in Ontario to grow to 6.5 million by 2030. So we have a lot of work on the go now and much more to come.
Right. Yes, I know we have this. The aging population is going to make the more caregivers needed and required. Hopefully, as we go through our discussion, we'll talk a little bit more about that.
Great.
When we talk about caregivers, who are we speaking about, and who are they caring for? Sort of age, demographics, gender, diverse communities. There are many benefits and joys of being a caregiver, but there are also challenges. How are caregivers coping?
So caregivers can really show up at any age or stage of life. We have young caregivers who might be caring for a sibling, a parent, a grandparent, anyone within their family or even their community. We have people caring for spouses at any age or stage of life as well. Parents may be caring for children, perhaps someone with a disability. And then we have adult children of their parents who may be moving through older adulthood. So caregiving can be something that we can anticipate, like through the aging process, or it can be something that happens overnight related to, say, an accident or even an unexpected diagnosis. So there are so many unique caregiving experiences that people can have. And anyone who's been a caregiver knows that it is not a linear process and it's really not predictable. So we know that caregivers can be any gender. We do know that women do take on more caregiving responsibilities. However, there are lots of different caregivers and lots of different family constellations, community connections, chosen families, lots of different ways that people can be a caregiver. Tom, can you remind me of your second question there?
How are caregivers coping?
So what we know from our Spotlight report is that caregivers are not coping very well. We see the rates of burnout for caregivers rising year over year. When we started doing Spotlight 6 years ago, caregivers were getting to burnout after 5 years. Now we see that caregivers are getting there after 2. So that's a fairly significant number for us to pay attention to in terms of the majority of caregivers tell us that they are struggling to cope and that they don't know how they can keep going. And so we know that broadly across the population of caregivers, and we certainly see that with the caregivers who are reaching out to us through our 24/7 helpline, looking for some of our programs and services, perhaps needing very significant types of support within their community. So we've got a lot of caregivers facing challenges, and one of the things that we know can make a difference is connecting them with the support that they need, not only for them as a caregiver, but of course for the person that they care for as well.
How are people getting in contact with you if they're experiencing that caregiver burnout? Are they reaching out when they're at that breaking point, or are they given referrals to you prior to that from other healthcare providers? How does that system work? Word of mouth could be as well from a neighbor who is aware of your services.
You know, we would like caregivers to get to us as early as possible, and we would like to connect with them before they reach burnout. That's for sure. But at the end of the day, it depends on how they've learned about us and where we've met them on their journey. So sometimes it does come, as you say, from a referral from a healthcare provider. We're seeing an increasing number of those, and we love it when individual healthcare providers or organizations anywhere across the health and social care spectrum, if they refer caregivers to us, that is great. We also know that people are finding us online. They may not even be using the word caregiver. We hear from people who are saying, you know, I did this search about, I need help with this. And somehow through that search, they come to us and find our website, ontariocaregiver.ca, which is a great place to start. You will find, of course, everything that you need to know about us and what we do and how you can connect with our services there. And then we do have our 24/7 helpline that's available in English and French and has translation in up to 150 different languages. So if people don't want to navigate the website and don't know where to start, that helpline can be a great place to go to talk to someone, find out what you might need from an organization like ours, but we can also refer you to resources and supports in your community as well.
Great. Sorry, Tom, you had a question that you were going to ask.
Well, I'm a caregiver, and I have been now for about 10 years for my spouse, and there's no children There's no family that are sort of close by that could help out in any way. And so I'm basically on my own for my partner, and his needs are increasing. And so it's become basically a 24/7 role. Biggest challenge for me is, I guess, the lack of supports that are available for caregivers, whether it's various healthcare or home care services, but also just in terms of being able to get a break, having a respite that I need, and the concern about burnout and care fatigue for me is becoming a really important consideration.
Tom, unfortunately, your story and your experience are not that unique. And we hear from a lot of caregivers who face some common challenges that you've just described. First and foremost is the loneliness and isolation that caregivers can experience. And I heard this from what you just described, Tom. Especially if there isn't a circle of care to draw from. And there are lots of people in that situation for a variety of reasons where it's really them and only them as the caregiver. And you identified that in your story of your experience. So this is where connecting with an organization like ours can really make a difference. Some people like to connect with a peer mentor who may have had a similar type of journey. They may want to join a peer support group. There are folks who may be eligible for things like caregiver coaching to create a plan. Those are options that people can look at based on what works for them. But sometimes the thing that caregivers tell us they need the most is just to know that they're not the only one, and to find ways to connect with other caregivers, other stories, other strategies that people are using. And we know, because caregivers tell us this time and again, they want hope. They want to know that there's hope along the way in their journey, and hope in terms of support for them. So, we definitely want to reinforce that message that you're not alone. But you also highlighted, Tom, about getting connected to the resources, because one of the reasons that you feel strained in the ways that you do is because you need more help. And this is a real challenge that caregivers face consistently in so many different ways, regardless of the circumstances or needs of the person that they care for. And so, we work with our system partners around looking at what are the creative solutions to connect caregivers with the support that they need, not only for themselves, but particularly for the person that they care for. And how do we work with new solutions that can help maximize the access and reduce some of those barriers that people face in getting access to the care and support that they need. But certainly caregivers tell us time and again that we have a lot of work to do in that area.
It seems that, the healthcare system really does rely on caregivers. They're almost like the backbone of our healthcare support. We make this assumption, as you've already alluded to, Amy, that, if we have an accident or we go into hospital, particularly for older adults who, in Tom's situation, same thing, and many caregivers who are alone, that we assume that when you're discharged from hospital, that someone is going to be there to help you, to be at the home, to open the door, to, help you with your care needs, to get your groceries. But in fact, that is not a reality and could be changing in the future. So I know you just did a report around preparing to care, and also your impact report that is coming out about driving meaningful change. So, based on that report, are you seeing are we going to be really prepared for this growing demand, and the caregivers in the future, are they willing to sort of step up? And if not, is there reasons why they might not be doing that?
There's so much to unpack from your question. So we could spend the whole time just talking about that. So let's talk about preparing to care.
For sure.
So we know there are 2.5 million Ontarians who expect to face caregiving demands in the next 5 years. They know it's important to have a plan, but they don't necessarily have a plan. And in particular, they may not have spoken about all of the different considerations considerations that they need to talk about with the person that they're expecting, or people, because sometimes it's more than one, the person or people that they expect to care for. So we've got some tip sheets on our website that provide multiple points of entry, multiple considerations, because some people may not want to talk about money, for example, but they may want to talk about decisions related to care, or they may want to talk about plans related to housing. So there's lots of considerations depending on your relationship with that person and what their needs and circumstances are. So we've got these people who know it's important to prepare, but they're not prepared yet. And for those folks, we would say, look at some of those tip sheets, get ready, have those conversations, start somewhere, and then keep going. So those are the ready, willing, and able folks. Then we have a large portion of people. We have 2.7 million people in the province who say, I expect to face caregiving demands in the next 5 years, largely related to aging, and I don't anticipate that I will do it. And those folks say that they won't do it, usually for one or a combination of the following reasons. Practical barriers, whether that's around where they live, what their working conditions are, whatever the situation may be on practical considerations. Emotional, I don't think I'm able to kind of take on this responsibility, or some other kind of functional barrier. We know, for example, if we talk about finances, caregivers spend an average of $640 a month on caregiving expenses. That's an untenable number for a lot of people. So that may be a consideration. And then another reason that people may not be prepared to step up is because they actually think that all the care that's needed will be provided by the system. But you talked about the fact that caregivers are the backbone. Caregivers are actually providing 75% of care in our system.
Wow.
So it is built on this reliance on caregivers. And so when we think about, as you highlighted, changes in demographics, the aging population, it's really important that we are supporting people in being caregivers and not leaving them feeling like many people like Tom feel like today, where they're alone and they don't have enough support. And we have a lot of work to do in that area.
Are we seeing a sort of a shift in any attitudes or behavior, like around, I'm not going to take on that role because, it's not my job? Does that play into effect of like, I know that the financial is a big factor, people feeling that they're not prepared or even getting training. I mean, sometimes people have really complex healthcare needs that don't, they get discharged and they don't know how to provide proper care, which then that leads to further stress and burnout. And sometimes, in situations can lead to abusive behavior because they're just so stressed out, not intentionally in some cases, because they just don't know what to do. But, I'm just wondering if that has any bearing on why people may not want to take on or other reasons in that regard.
I do think the training and that sort of readiness piece is definitely a factor. And we hear this from caregivers who may be doing tasks that they're not ready for. So sometimes that's about physical ability. So if we think about things like lifting and transfers, maybe they're not able to do that, or maybe that's something they've done before, but they see there's an increasing need and they're not going to be able to meet that need, right? Based on their own health circumstance, that can be a part of it. We also know that there are some caregivers who are doing fairly significant medical tasks at home. So I'm not talking about things like medication management, though certainly many caregivers are doing that, but where they're actually performing tasks that, a home care worker or a nurse or someone else might be doing, but they are the person there 24/7 and they're doing it a significant portion of the time, but they may not know how to do it. Wound care is another example. So I think your point about training is a really good one. Usually people need just-in-time kind of training, but we also hear from caregivers that they don't want all of these responsibilities and burdens to be continued to downloaded to them, right? Caregiver burden is already significant, and they're saying, I need help. So even though we want to scaffold caregivers with as much support as humanly possible, we also need to make sure that they have access to the care and support that they need on that through that process.
for me, as a member of the 2S LGBTQI+ community, one of the real concerns is around those supports that are available, but whether it's home care or access to health care, is the concern or perhaps the fear about how we will be treated or mistreated, or how our particular health issue or issues around social isolation really aren't understood by the care providers. And so an important issue for me, and I think for our community, is ensuring that the service providers are also educated and have the awareness that they need about the particular health and social issues and concerns of members of our community, and also, quite frankly, about our concern about whether or not their homophobia or transphobia may be one element of the service provider that leads to mistreatment or neglect or failure to understand the particular issues and concerns and how they might be addressed.
You know, you've highlighted a common concern and issue that caregivers face in the LGBTQ community, for sure. One of the things that we're doing around that is working with caregivers with lived experience. And this is something we do with caregivers in lots of different areas related to their lived experience, to create resources and supports for them based on their particular needs. So this year we launched adaptations of one of our toolkits. It's our I Am a Caregiver toolkit. And one of the adaptations we did in collaboration with LGBTQ caregivers. So that's a way that people can access some information that's been created in collaboration with those caregivers, that's been adapted accordingly, that highlights some of the needs of community. And to your point, issues related to stigma as well as access can be significant, because we know that people may not recognize caregivers who are partners or members of chosen family or whatever the case may be, and that, to your point, there is education that needs to be done. So we want to be sure that we have supports for caregivers navigating those types of situations, that we can connect them with peers within their community who may also have related caregiving experience. And then we have to work with those healthcare providers around caregivers. Are caregivers when that person chooses them. So the patient, client, resident, whatever the case may be, if that person says, this is my caregiver, then it is incumbent upon the healthcare provider to then recognize them as a caregiver, include them as a part of the care team, and connect them with the support that they need. So I've said this already, I'm going to say it again. This is an area where there is more work to be done for sure, but it is definitely a priority area, and we want to be sure that we're doing that with caregivers with lived experience, and that we're highlighting the specific barriers, stigma, concerns that are being faced, and then looking at what are the concrete strategies and solutions that we can work on, not only in terms of what we do as an organization, but how we work with our system partners to address that.
Yeah, thanks. That's a great explanation. And just to give us more in depth about the toolkit that you have, I was on your website and looking at some of those fact sheets for individuals in the Chinese, Filipino, Tamil communities as well. And I think that's such a really good resource, because some of the information may not be available, particularly in their language as well. And having consultations with that community makes a really big difference. And because they're the ones telling you what they do require. So I commend you for doing that work. That's, I think is so well needed, and making it accessible for people as well. Just coming back to the issue around, I guess, the financial piece. The cost of over $600 a month can be, tremendous, and that's probably the bare minimum, I would suspect, especially if someone doesn't have healthcare coverage to buy some of the medications and, the equipment that someone might need. Are you finding people also leaving jobs, or what is the employment sector? Are they being more considerate, I guess, of the needs? Because some people may have to take days off, and we've seen some shifts in people changing and being more proactive in that regard.
So on the finance side, caregivers can be impacted in a few different ways. One is, as you're talking about, the out-of-pocket expenses for caregivers. And that can be things like medications. It might also be medical devices. It can be those specific things related to the care needs of the person they care for. Caregivers may also be paying for things like food or rent or transportation, some of those daily living costs that people have. Obviously, that depends on the circumstance, but we certainly know there are caregivers who are paying for that. But the other side to it, which you highlighted, is how does this impact caregivers' abilities to gain and maintain employment? So here's what we know. There are caregivers, of course, who cannot work because of their caregiving responsibilities. So that obviously has a significant impact on their income and what they're able to do for themselves as well as other people. There are some leave provisions. They're fairly narrow and not, meeting the needs of all caregivers at all. But there are caregivers who say, I've had to leave my work or I'm not able to work because of my caregiving. There are also caregivers who have lost their jobs because of their caregiving responsibilities. That should not happen, but we know that it does. And we also know that there are people who fear that they will either lose their employment or have to leave their employment because of their caregiving responsibilities. So this really depends on the unique circumstances of the caregiver. It depends on their employer and how supportive they are. And so that is why one of the other areas of focus that we have as an organization is working with both working caregivers and employers on this issue. So with working caregivers, we're providing them with supports about how do you talk to your employer about this? What might you be able to ask for? What are some variables and options that can work for you? And again, people can find that on our website at ontariocaregiver.ca. But we know that we also have a lot of work to do in this area with employers so that they can be caregiver-friendly workplaces. We see that being a caregiver-friendly workplace is actually a recruitment and retention tool that employers have. And especially when we see how many people are becoming caregivers, this is even more important. So we do see some positive trends. We see employers who are interested in working with us and others on this issue. And we hope to see more and more caregiver-friendly workplaces. But right now, we do have a mismatch between people's current experience and the expectation of those future caregivers that we talk to in preparing to care. So we have an opportunity to close the gap and say to employers, people are going to be looking for flexibility, options, understanding from their employer. And this is going to be a major population trend, both in terms of aging, but also increased incidence of chronic disease. And so we have to bring this conversation forward and talk about it in terms of what it means in the workplace.
Yeah, that's a great, the flexibility, I think, is the key word there, and being able to adjust and, times when people work. And, when we had, the COVID, when we really did a big shift in the way that we work in our workplaces, that's kind of maybe I don't want to say benefit, but that might be a way of us, being more flexible, understanding that we can change things differently than what we have done in the past. And maybe this is one of those considerations. So how are we preparing, or how can we engage prospective caregivers to prepare themselves to be, future caregivers if they anticipate, a relative that's getting older? We have aging grandparents or in-laws. And I haven't really thought about it. We know it might happen in terms of future because people age and will require support. But how can I and other people that are listening think about what steps that they can take to do that preparing?
So I think the first step is exactly what you just talked about. Okay, this is interesting. I have these people in my life. I see that they are aging, as we all are, and I know that this is coming, but I haven't really thought about it. So a great place to start is with some of our Preparing to Care resources on our website. We have a tip sheet. 1 page, short and easy, some things to consider. So that's one thing that people can look at. I would also say, just open up the conversation. Hey, this may be uncomfortable. People may not want to talk about it for a variety of reasons, but what are you thinking? What are you hoping for? What are your plans? What are your expectations of me? Right? And so just being able to talk about that, even if it's things like, where do you want to live when you're older? And is there a plan for that, right? And people might say, okay, I want to live at home. Okay, but maybe there's lots of stairs. So how are we going to work through that? What's it going to look like for you to live at home? What if you need support there, right? So lots of different ways to explore this. And I would say, to think about the practicalities of daily living. What's the plan if things don't go to plan? Do you have things in place financially, legally, around powers of attorney, wills, those kinds of things? Those are important things to look at. And I think it's important to have that conversation. Okay, are you thinking this is going to be me? I'm thinking it might be me. Do you think it might be me? If so, what would that look like? What do you want from me? What do you not want from me? And I appreciate that these can be tough conversations. One of the best recommendations that I've heard is, don't have this conversation around the table at Thanksgiving. Right? This is not a holiday kind of conversation, but it might be over a cup of tea or coffee or on a walk or whatever it is, to just say, I've been thinking about this. When we're talking about it at work, I heard a podcast, whatever it is, and open up the dialogue. And that really makes sure that they're taken care of, but it also makes sure you're taken care of. Because if we're talking about caregiver stress and burnout, part of it is these things arrive and we realize the demands on us may be far greater than we anticipated.
Yeah, that assumption that, we haven't had that conversation, and this, just doing this podcast is going to make me think, well, we had this podcast and we had these conversations, like, how would you, what are you expecting, or what do you want, your best wishes? I mean, that's what we really want to make sure is what would they anticipate? And it's like many health issues. We don't want to talk about it because we don't want to think about the bad, negative things that are going to happen in the future. But in fact, we need to, because we need that, as you say, we need to have a plan, particularly with the reliance as the backbone of families and other neighbors being that healthcare provider. So thank you for that, because now I'm going to take that advice and use it myself. So I'll turn it over to Tom.
Yeah, thank you. What advice would you give to empower someone, in particular seniors, to age vibrantly?
Oh, that's such a great question. Well, I'll pick up on the theme of our discussion so far and say, have a plan, right? What are the plans and goals that you have for yourself, whether that's physically related to, movement, mobility, etc.? Are there things that are important to you around family or community? Think about if we make these decisions driven by our values. So it's really important to me to stay connected to family. It's really important to me to be connected with my community, however you define community. It's really important for me to be able to work in my garden. Whatever those high priority items are, then we can build a plan around those things. And we hear some amazing stories from people about how they've adapted to be able to continue to do so many of the things that they want to do into older adulthood. So if we use gardening as the example, people will raise a bed so that they don't have to bend over so far to tend to their tomatoes, right? And I think that that makes a huge difference. I'll just say too, as an example, for my dad, who's in his late 80s, he works on the use it or lose it kind of principle. So he's a big walker, and he's had some health scares. And one of the things that he and I have prioritized doing is, to the best of his ability, as we've navigated some of these health situations, we keep up the steps, because we know it's a lot easier to maintain that than it is to try and get it back. So he and I have had some good walks through emergency wards before, where we've been hanging out there for an extended period of time. And that's been part of him keeping his vibrancy, is being able to maintain those steps to keep him walking safely and well into his late 80s. So I think having a plan is great, knowing what's important to you and then building your plan around that. And then really figuring out, are there supports within the community that can help as well, whether that's, people galvanized around something that you're interested in, faith-based community, other types of resources and supports. How do we get connected with those things so that when we need them, we know who to call or reach out to?
Great. Well, thank you, Amy. This has been such an insightful conversation that we've had. I've learned a lot. I've got a lot of advice, and going to take back as my next visit to our family members, to have some of these conversations to open the door for the conversation about caregiving and what the needs are for everybody, and including ourselves. Like, we make so many of those assumptions. And thank you for sharing all the resources and the work that you're doing to bring system services together, to have these conversations, to expand the outreach that we have and the documentations and the reports, because they make a difference in having a better understanding of what the trends are and how we need to move forward. So everyone, to encourage them to look at your website. We'll put that in the show notes so people have access to it, as well as referencing the tools and resources that you mentioned today. We thank you again. Wish you all the luck and the work that you're doing as you move forward. Thank you, Tom, for joining us as well and sharing your personal experiences for both of you, in fact, because I really think that it really lands for people to understand the perspectives of people with lived experience. So thank you both. And I look forward to meeting and connecting again on this important conversation.
Thanks so much for having me. I really appreciate your thoughtful questions and the opportunity to talk about these things. And, I think one of the most important things for us in the work that we do is to do it together. And so this is a great opportunity to build on that. Thank you so much.
Thanks. Thank you again, Amy, for informing our listeners about all the resources and services that caregivers can access from the Ontario Caregiver Organization. I encourage everyone to start the conversation now with their family, partner, friends, or even neighbors to prepare for your care. Remember, whether you've been a caregiver for 5 years or you're new to the role, the Ontario Caregiver Organization has resources that can help you. So reach out today or visit their website at ontariocaregiver.ca to check out all of their supports. To find more information and links to resources mentioned in today's episode, please visit our show notes. We encourage you to visit Elder Abuse Prevention Ontario's website at eapon.ca. Aging Vibrantly, Conversations to Empower Seniors is hosted by Raeann Ridout, was produced by Lisa Whitfield, and edited by Todd Miller of Podcast Experts. The original music is by Red Path Audio. We want to thank Help Age Canada for their financial support to produce this season's podcast. Please rate, review, and subscribe to Aging Vibrantly wherever you get your podcast. And if you're on Apple Podcasts, give a great rating and a review. If you prefer to watch our interviews, full episodes are available on Elder Abuse Prevention Ontario's YouTube channel. Be sure to check us out. Until next time, stay vibrant.